So my name is Scott Weingart. I'm the Director of Emergency Critical Care at Elmhurst. I'm dual trained in emergency medicine and critical care, and I've put in a lot of central lines. My whole push in this education process for central line placement is not just safety in placing the line, but patient safety later on and maintaining a full sterile technique whenever possible. Because even though the line might look fine when you place it, if it wasn't placed sterile, the patient could go on to have complications later on that you won't see in the emergency department or on the floor. So it's really critical to place these lines just as sterile as they would be placed in an operating room environment. Now, HHC has created a bundle to make this a lot easier. There's so much equipment you have to gather that when you had to just go to the stock room and try to grab it, it was near impossible. So the bundle really makes this much, much easier. And once you learn how to use the bundle, you realize just how easy it is to provide a full sterile central line. So the things you need is, you need the bundle itself. You need whatever central line you're going to place. This happens to be a triple movement. If you're going to use ultrasound, you need an ultrasound sleeve. And for reasons I'll show you in a sec, I don't like the sterile gloves in that kit. They're like dishwashing gloves, so I just grab a pair of sterile gloves. And that's all you need, really, plus your ultrasound machine, your patient. Our patient happens to be decapitated, but we won't let that stop us. And consent, obviously. And then you're ready to go. Now, you got to have a table to place your stuff on. If you try to do this on the patient's bedside, it's inevitable. They'll move, they'll shift, and everything's going to get thrown on the floor. That's not good for sterility. So you want a table. You have to have your patient well positioned. If you're going to do a line in the IJ or the subclavian, you want them in Trendelenburg to lower the risk of air embolism and to make your veins more dilated. And you want the patient's position to be in a position of comfort. Sometimes I'll actually, if the patient's conscious and they might be a little bit delirious, I'll actually put them in restraints to keep them from reaching up and grabbing your sterile site during a procedure. So when you're ready to go, you're going to take your bundle. Pop it on your table and open it up. And the first thing that's going to be there is these two masks. And the reason there's two of everything is if there is someone supervising you, they should be in sterile garb as well. They shouldn't just put on a pair of sterile gloves and reach into your field, because then it's no longer a full sterile procedure. So there's two of everything. If you're alone, you just put one aside. And you put on your mask right up front because you don't want to be breathing and talking into your sterile kit. Anyone at the bedside who's watching, maybe a medical student's observing, and they're right next to you, they should be wearing a mask as well, so that they're not breathing into your sterile field. You're going to open this with sterile technique, and the first thing you're going to see on top is a set of gloves. And now, I really don't like reaching into sterile fields to grab stuff. The way this is set up, this is the one time you have to do that. There's really no other choice. So you just want to touch those top pair of gloves, not touch anything else, and just take them out of the kit. And that's really going to be the only time you're reaching in there with non-sterile garb. All right? And at this point, I'm going to put on these gloves. And you're going to keep them sterile. And these are not going to be the gloves you're wearing during the procedure itself. So they don't have to fit you perfectly, and in fact, these will fit me really badly. But you're really just going to use these to reach in now and grab your gowns and everything above them. And that looks just like this. There's two gowns, there's a couple of hats, there's one more pair of sterile gloves. And I'm going to pop those down there. You have your drape, and you're just going to lift your drape up and grab your cora prep stick. Now, we really advocate chlorhexidine as opposed to betadine to be able to declare a line full sterile in HHC. It has to be chlorhexidine. So you crack this stick open, and you can test on the back of your sterile glove to make sure it's free flowing. And now you're going to prep your patient. They should have already been placed in whatever position you want them in at this point. And from this point on, they have to stay sterile. For this particular line, I'm going to go in the IJ on the right side. But I'm not going to prep just the IJ. I'm going to prep the patient's entire right side of their neck, all the way down to the bed, all the way across, and then I'm going to come down and prep the subclavian site as well. Because if I can't access the IJ, I then could go directly to a subclavian approach without having to re-sterilize the patient. So I'm just going to start right over my site, scrub the entire neck. I'm going to cross the midline, and now I'm going to come down to the subclavian, to the clavicle. Underneath, I go about a quarter way down the chest because antiseptic is cheap and central line infections are really expensive. So don't skimp on using these sticks to get as much of the patient surface covered as possible. And now we can discard these. And at this point, you can take off this set of gloves. So you're going to open up your central line and drop it onto your field. And then you're going to open up your ultrasound probe and drop that onto your field as well. So what I like to do is I like to take my sterile gloves, open them up, and have them on a flat surface. Right, take our hat, put that on. Now we're going to put on our gown. Now the gowns always are going to have the non-sterile side facing out because that's the only side you can touch. So you never have to think which side goes against your chest because the side you're actually holding is always going to be that side that's going to go against your chest. So you know if you see the gown like this, that it's going to go against your chest just like so. What I like to do is I like to open up my gown, and I actually like to secure it behind my neck before I put my hands in the sleeves. Now the reason for this is you could do this line totally self-sufficiently. All right, now I have that secured behind my neck with Velcro, and I'm going to put my arms in the sleeves, but my hands are not going to come out. So I just have these little white things hanging here, and this is going to allow me to keep full sterile. It drives me crazy when I see folks put on the gown like this, and then they go and open up their gloves, and they're doing one of these jobs where they're now putting on their gloves. It's not sterile. It's horrible. It makes you look like an amateur. So you put on your gown and you leave your hands in your sleeves. And you're going to use the sleeve itself to pick up your glove. And all you do is you push this white sleeve into your glove, like so. So now my hand has never left the sleeve. At that point, I can actually pull my hand into the glove. And this is going to allow you to really maintain sterility without any question. Because my hands never left the sleeve. There's no way I could have contaminated that glove. Now on this side, you can actually pick up that glove now because this is a sterile glove, picking up a sterile glove. And again, put the white thing inside the glove. And now you pull your hand through. You just pull your sleeve on. All right, so the hands have never left the sleeves themselves. There's no way this could be anything but full sterile. All right, now we're going to move to our kit. You want to put it right up against your bed in an ergonomic position so you don't have to go reaching. Now you're going to take the drape out. The drape tells you where it's supposed to go. It says head right, head left. If you're using the right side, you take the head right side. And it has arrows pointing to where the top of the head should be. That's what those arrows are right there. So you're going to strip that off, and you're going to come to your patient, and you just pop that hole over your site. And now you open up the drape, and it always pulls towards the head first. So you hold your drape steady, and you open up the head portion. Now, at this point, you can open up your little paper covering, and you have a perfect site now for your central line. You stick it onto the patient. Since you prep so widely, there's no question that your field is actually going to be an area that's been sterilized. All right, what I like to do next is actually get my ultrasound probe cover on. So I'll take out the gel, put it on this little piece of paper here. And, all right, do me a favor, just squirt some gel onto that probe. Okay. Now, what you want is when you take these probe sleeves out, there's always one side that has a floppy end and another side that's basically a hole, which you can see right here. You want to put 2 fingers on one side of that floppy end and your thumb on the other. And what you're basically making is you're making a mouth. And now that mouth could pick things up. All right? So I got this situation right here. What I'm going to do is I'm just going to grab the probe and lift and pull down on the rest of the sleeve. And now I have a nice full sterile ultrasound probe. Take these rubber bands, actually lock that probe cover on, take some of my gel. Now my ultrasound probe's ready to go. Now the key to this is to have looked at your site with the ultrasound before you got sterile. So you've actually figured out the depth, you know where to go, you've verified that this is actually a good vein, that's a nice big wide patent vein, before you start all this. Because you don't want to spend all the time getting full sterile and you get your site all ready and then you slap on the ultrasound probe and realize that your IJ is the size of a pinhead while that other side is beautiful, wide, and patent. So figure it out before you start all this that it's a good place to go. And that'll also have your machine all set up with your depth, with your gain for the ideal line placement. Now we're going to open up our central line kit itself. And your sterile flushes are actually in your line bundle. So you're going to flush all 3 ports at this point. You first withdraw until you get flash back, and you bring it to just to the level of the hub. And then you make sure the air in the syringe is facing the ceiling, because if you hold it like this, it's actually the air you just took out is what's going to be injected. So you hold that towards the ceiling, tap it to get all the air up to the top of the syringe, and you flush it. And it takes about 3 or 4 cc's is all you need. And then you close that port off, and you cover it with the cap. We're going to do the same thing for each of the other 2 ports. So now you have all 4 ports sewn, and now you're actually ready to clean your site. And that's why there's another cora prep actually in your kit. So you break that open just like before. Make sure you have a good flow. And you're just going to clean all the drops of blood you might have put around the area that's going to be under your dressing. Try to get in around the line itself as well. You know, sometimes under your stitches there's some dried blood. That dried blood is a nidus for infection, so you want this to be a nice, beautifully clean site. All right, now you're ready for the biopatch, and all the biopatch is a chlorhexidine impregnated dressing that's actually going to continue to elute chlorhexidine. Now, there's 2 sides to it. There's a blue side and a white side. And the way we remember it is the blue side faces the sky. All right, so the blue side's going to face up. And what I like to do is I like to take my needle driver and actually pop it underneath the line, and I'll just place the biopatch into the jaws and the needle driver and just pull through, just like so. And now we have our biopatch on just where we want it. Take some sterile gauze and just clean up my site, make sure it's nice and dry. Now ready to dress the line. At this point I'll take off the sterile drape, and I'll actually now try to orient my dressing to fully cover I guess we can't push it in. Yeah, this is that 30 centimeter line, which is a real problem for sterility. Alright. So now we're going to place the dressing on in such a way that the line is entirely covered by the dressing. And so just something like that.